How have I spent 12 years of postgraduate education and not one person, not one professor has told me that you need to train this, that your brain's job is not to keep you happy. Your brain doesn't care if you're happy or not. Your brain just wants to keep you alive. That's it, full stop, period. It's your job.
What an incredible presentation. I absolutely loved hearing Dr. Alabal.
So her speaking today was an incredible experience for not only myself, but I had my whole office here and we all picked up some really amazing tips. And thank you so much, Dr. Shahana.
I absolutely loved the presentation today. It was so heartfelt. It was so real, authentic.
Lower your hand now if you don't know anyone that suffers with a mental health condition. Lower your hand only if you don't know anyone. Look around the room, everybody. Look around the room.
My name is Dr. Shahana Alabai. I'm a family doctor. I trained at UBC. I'm a TEDx speaker and had the honor of giving a talk in 2019 about the importance of emotional literacy for better mental health. And most importantly, I'm a mom. I'm a mom of 3 young boys, age 4, 6, and 8, who teach me every day the importance of understanding and regulating my own emotions. When I think about the problem that I help to solve, the word overwhelm comes to mind. I think so often in our society we ask the cardinal question, how are you? How are you doing today? And what's the most common answer is fine. But when I give my presentations, I love to pause on the fact that, are you actually fine? How actually are you doing? And most of the times, a lot of us are far from fine. We just feel like we're okay, blah. We're just existing. That, understanding that I'm surviving but not thriving. We've all heard that phrase before. So when I give you this talk to your audience, when I address your audience and address your membership, the idea is how can we move the needle from just surviving to doing more than that? And the gateway to do that is through understanding our emotion. I think the problem that we want to solve in our own life often stems from a story. One of the favorite things I love to tell my patients is that each one of you is unique and each one of you has a story. In terms of life, that's the only thing you really own in life, is your own story. And something that I've struggled with for a long period of time, and it was only on the TEDx stage that I was honest about it for the first time, is my own struggles with anxiety, depression, and postpartum OCD. After the birth of my first son, that was the time that I hit my personal rock bottom. And I don't think anyone's story resonates as much as your own sometimes when you have had to face those adversities, especially when you're in a position of trying to help others.
When I was going through postpartum OCD and anxiety after the birth of my first son, my mom would come up to me. She would almost want to shake me by the shoulders and say, Shahana, just tell me what you're feeling so I can fix it. And I remember looking at her going, I feel nothing. I feel nothing. Even numbness, the absence of emotions, is also having an emotion too.
And it was understanding the power of my emotions that helped me put me back together in some forms too. And I'm not saying there's not a role for counseling or for medication, but for once for my patients, I want to give them a preventative tool. And that's where your emotions come into play.
It takes me about 2 seconds to sign your prescription for Zoloft or Prozac or Cipralex. That's not the hard part. The hard part is actually sitting down and going, what brings you here? Tell me your story. And probably the most important thing is why now? Why now? Every single person in this entire world has this, an emotion. You can go 3 weeks without food, 3 days without water, 3 minutes without air, but you can't go a millisecond without feeling something.
Mental health is not a you disease. It's not a me disease. It's meant for all of us. That's what we need to think of mental health as. When I talk to a patient now, sometimes I'll say, does anxiety feel like this in your body? Or does depression feel like this? And sometimes they'll look at me with this inquisitive look, almost as if I know. And I do know. I do know what all of those emotions can feel like as well. So by speaking a similar language and by allowing us to actually have a space that's safe, where they feel like they're not alone, this is the foundation of allowing them to feel better.
Don't tell yourself, oh shoot, I shouldn't feel this way. You feel what you feel, and the curious paradox is that when you accept what you feel, even for a nanosecond, it says nothing about you. Just accept it and allow yourself to move on.
I've been fortunate to be trained in family medicine with a background in kinesiology. I've done additional training in cognitive behavioral therapy and mindfulness meditation. But I take all of that because, as you know, education is just the start. It's just the start of a springboard, and it's listening to patient after patient. And after 12 years of serving as one of the lead physicians at BC's largest youth health centers, I've been able to take the experience and the stories of my patients, blend them with my personal stories, and come up with the pearls that I hope to share with your audience.
We absolutely loved everything she had to say. It was amazing to kind of dig deep in the emotional roller coaster we're all on as women sometimes. And for my daughter here to hear those words as well is really exciting for her. It was great. She did a really wonderful job.
It was a great time to step back and listen, and I'm excited to take some of these breathing tips into play.
It was an amazing speaking done by Shahana. It kind of related to every woman, every mother, I guess, around the world, because we all feel the same. And I think it was very well put together with the humor and kind of putting everybody's life in perspective. And it's okay to be who we are and just living in this world. So thank you, Shahana, for this wonderful talk today.